Thanks so much for joining us today. The Nutrition Aging Resource Center is excited to offer more resources from our guests with Open Hand Atlanta, focused on the topic of reimbursement for nutrition and meal services. My name is Ashley Danielson. I am the Nutrition Coordination Director with the Nutrition Aging Resource Center, and I'm excited to be here with you today, along with two of our guests from Open Hand Atlanta. We'll start with Laura Sanada. She is the Director of Nutrition Services and leads Open Hand Atlanta's Nutrition Services Program Development and Delivery. Laura has been a registered dietitian in Atlanta and previously in Chicago since 2009, primarily focusing on improving food insecurity and health for those living with chronic illnesses. At Open Hand Atlanta, she developed the team's telehealth initiative and is currently coordinating the service expansion across Georgia and designing a teaching kitchen. Additionally, she is a master trainer for the Diabetes Self-Management Program and Chronic Disease Self-Management Program, implements Cooking Matters, leads the Open Hand Wellness Committee, and has coordinated many partnerships with health systems, health plans, and other nonprofits. She has presented at conferences and webinars, including FENCI, Meals on Wheels America, National Council on Aging's Age in Action Conference, the Food is Medicine Coalition Annual Symposium, and the Root Cause Coalition Annual Summit. She holds committee positions, including co-leader of the Food is Medicine Coalition Clinical Committee, and participates on many other committees. Laura brings excellence in project management and oversight and innovation in Open Hand's service offerings. Our other guest today is Alina McLean. She is currently the Senior Director of Client Services and Outcomes for Open Hand Atlanta, where she has been employed for the last 19 years. She directs client services team members who work to ensure that services are coordinated with multiple community partners and providers, and that clients are satisfied with services that are received. Alida has been a driving force in Open Hands becoming the preferred provider of partner agencies. Alida also manages the programmatic team, which leads programs and policy, processes, and evaluation of outcomes, as well as overseeing government grants. He is a member of the Metropolitan Atlanta HIV Health Services Planning Council and the Food is Medicine Coalition. Welcome, Laura and Alida, and I'll let you take it away.
Thank you, Ashley, for that wonderful introduction. Next slide. So I'll start off with a brief overview of who Open Hand Atlanta is. We're a leading nonprofit nutrition service agency that's been around for 35 years. We actually just delivered our 35 millionth meal this past year. Out of our kitchen here in Metro Atlanta, we deliver approximately 5,000 meals each day throughout the entire state. We utilize approximately 10,000 volunteers annually to help deliver our meals and package them right from our kitchen. We have a staff of approximately 120 employees, mostly operational staff that are planning our menus, cooks that prepare the food, packaging up food, and some of our delivery drivers. Out of that 120 employees, we have 11 registered and licensed dietitians, and we do about 400 meal choices for our client center menus. So for our registered dietitians, we have some that focus strictly on menu design and preparation. And then we have registered dietitians that go out into the community to conduct our nutrition education services and counseling. So in terms for reimbursement for our meal services, I'll start off with our Medicaid program. So for Medicaid, you can get reimbursed a couple ways. One of them are waiver programs, and the waiver programs are specific to each state. In the state of Georgia, we have the 1915C waiver, which is a waiver for the elderly, is an elderly and disabled waiver. Within that waiver, those individuals who are at a nursing home level of care and unable to provide meals for themselves are able to receive meals, home delivered meals delivered to their door. There's also an opportunity to provide meals through Medicaid through another program called In Lieu of Services. So within this program, services can be offered in lieu of other medical services. So if they're getting maybe a home nurse, the plan can opt to have medically tailored meals in lieu of some of the hours for the nurse or for some other medical service that they may have been providing. Another opportunity for reimbursement for medically tailored meals is through Medicare. Medicare Advantage plans have an opportunity for individuals to receive uh, medically tailored meals as a supplemental benefit. So some of the plans can opt in to allow members to receive meals post-discharge, or they can just opt to receive meals as a value-added benefit that is a part of their Medicare Advantage plan. Each plan is different, and they can offer the service and the amount of meals and the length of time based upon their value-added benefit. Another way that Open Hand provides medically tailored meals is through the Ryan White Care Act. That program is specific to individuals living with HIV and AIDS. Open Hand started off as an AIDS service organization, so serving individuals with HIV and AIDS is still a core part of our mission. But within that program, we are providing up to 2 meals a day, 7 days a week for individuals living with HIV and AIDS throughout metropolitan Atlanta. And then another avenue to support meals, of course, is the Older Americans Act. And within that program, we're delivering meals to seniors. So Open Hand provides contracts with different, we contract with different county agencies in their senior services department to provide meals. So we're providing meals through about 9 counties that serve as older adults. Next slide, please. So with Medicaid, for a lot of you, Older Americans Act is probably the most familiar way that you're used to providing meals. But with Medicaid, they're expanding the options for states to provide medically tailored meals. So like I mentioned earlier, Medicaid is different in each state. So if your state doesn't have a waiver program, there has been dollars through CMS for innovation dollars to allow states to apply for 1115 waivers, which will allow the state to add a medically tailored meal program for their Medicaid population. So if you are not familiar with Medicaid or your agency is not doing that, there are a few steps that you need to do to get yourself started for that program. The first step is getting an NPI, which is a National Provider Identity Number. With that number, that allows you to enroll for the state's Medicaid plan to be able to bill for services. The only renewal as an agency, you have to kind of update your license annually and submit the documentation. But once you're enrolled, you're usually good for the entire year. Medicaid does involve a lot of administrative paperwork, so there will be some management of client files and documentations in terms of making sure your client has a prior authorization for the correct amount of services. And then you would have to bill for each person. Again, if you're not used to providing this service, because you're billing for each individual per day for the amount of meals that they received on that day. So to start off, you can probably do it manually, but as your service begins to grow, you can consider using a clearinghouse, which is a billing agency to submit all of your claims on your behalf. And then that way you're only uploading a file, but it can be done manually, but it's just a little time consuming if you do it that way. Next slide, please. And reimbursement for nutrition education. So we could also get reimbursed for the services that your registered dietitians are providing. Currently, Medicare will reimburse for medical nutrition therapy, which is nutrition counseling performed by a registered dietitian. Currently is reimbursed under Medicare Part B, and the referral has to come from a medical provider. And under Medicare Part B, they will cover a diagnosis of diabetes or chronic kidney disease pre-dialysis. In addition to the medical nutrition therapy, they will also cover diabetes self-management education, also referred by a physician or healthcare professional. So with these services, if you have registered dietitians on staff who are conducting nutrition counseling or certified in diabetes self-management, your agency would also have to become registered as a Medicare agency to be able to bill for these services. Next slide, please. So to become a Medicare provider, this is kind of a step-by-step process to help you go through how to become registered to provide these services, such as we already mentioned getting a national provider identity number, and listed is the exact forms that you would need to complete. So your agency would actually have to become a Medicare provider, and your registered dietitian would also have to become a Medicare provider. So there's two different forms that would need to be completed. And once the dietitian becomes a provider, they will need to then sign their benefits over to the agency so the agency can bill on their behalf. A lot of that is listed on their website, but the key thing is to make sure that the agency becomes a provider, and then the registered dietitian will also have to become a provider as well. Utilizing a clearinghouse would definitely be helpful. You could use the same one if you have one for your medically tailored meals, but setting up a clearinghouse is helpful because when you try to set up an appointment, you can then check the clearinghouse to make sure that the person is indeed qualified to receive the services before providing that particular service. Also, when it comes to billing, in terms of if there's any rejections or any issues, you will get notified faster by having the information sent to you from the clearinghouse. Next step, next slide, please. And then these are just examples of what the application looked like for the organization. Next slide. And what the clearinghouse is. So there are lots of options for different clearinghouses, but with the clearinghouse, you can determine eligibility, submit your claims electronically, get information on your payment status, all in real time. You're able to resubmit your claims electronically, which saves a lot of time and cost. Next slide, please. Okay, and now I'll turn it over to Laura to talk about our nutrition program and forms.
Awesome, thank you, Alida. So at Open Hand, we've developed the process of how to receive a referral, and there are specific items that need to be on the referral form. A lot of this can be found online, but happy to share our form if that's helpful. And then, there's just specific things that if you were to get audited, that would need to be in your program. So, the RDN charting note in paper or electronic format, an electronic medical record is helpful. We utilize Healthy for that for us. And then the dietitian needs to do some tracking on the appointments as well. So just being able to record the amount of time, and you calculate that based on 15-minute increments. And then you record the type of appointment, if it's in-person or virtual, if it's an initial or follow-up, and then the referral date, of course. For us at Open Hand, we are working through processes to screen our current meal clients for the type of insurance that we're looking for. So having Medicare Part B, and then that diagnosis of diabetes or kidney disease, as Alita mentioned. So we're working through that process currently and getting that up to date so we could find the clients that are coming to us already. But we've also formed a lot of relationships with clinics across Atlanta. And now we have a focus in rural clinics and sites as well, now that we have our telehealth platform up in action. But with the clinic sites, you know, we're making relationships with the case managers and the MAs and others who are making the referral. So making sure they use that particular form, it's signed by the RD, it has all the correct boxes and information filled out about the client for our paperwork trail that's required by the program. We can get into more details than that another time, but that's sort of basic of what we're doing right now. We wrote out our workflow if this is helpful for anyone as well. So it definitely starts with the referral and it has all the insurance information. We have a medical biller on staff at Open Hand who also helps us assess insurance eligibility. So if the medical biller finds that they're ineligible, of course, we are unable to provide the service. But if they are approved, then the dietitian can provide that medical nutrition therapy up to 3 hours in a yearly period. The RDN does the tracking and completes the required charting in the electronic health record. And then it goes back to the medical biller who submits the claim. We utilize Office Ally as our clearinghouse. And then it's up to Medicare. So they either approve or deny our claim. If it's denied, we'll try and resubmit with the changes that are needed. And then otherwise it's approved and we receive a payment to Open Hand. So it seems really simple, but it is very easy as long as you keep up with your paperwork and tracking. As Alita said, we also provide diabetes self-management education. And what we've learned through the process of becoming accredited is that there's 2 accrediting bodies, the Association of Diabetes Care and Education Specialists, or ADCES, or the American Diabetes Association. They both allow you to become credentialed and accredited in their programs to provide this service as reimbursement. So when we submitted to the ADCES accrediting body, and we utilized the evidence-based program that's from the Self-Management Resource Center. So we utilized their diabetes self-management program curriculum, and then just had to show ADCES how we were utilizing it, and the breakdown of the interactions with the dietitian and things like that. Within the accreditation process, you must have an RDN or CDCES, the Certified Diabetes Care and Education Specialist, on staff. We're lucky that we have a dietitian that is both. So that's really helpful, but any of our dietitians are now credentialed to bill to ADCES as well, or through ADCES through Medicare. The process includes, though, keeping a digital binder. There's some paperwork that you have to keep up for ADCES to potentially come and audit you. So you maintain an evidence of following their 6 standards. And then you have to have a written out plan for engagement, your outcome measures, the way you're tracking the demographics of your target population. And then you also pick a continuous quality initiative, I think is the CQI measure. So you pick a project that you're going to work on annually. the provider, the dietitian or CDCES, needs to keep up with a certain amount of CEUs each year as well. And of course, there's annual reports. So again, happy to answer questions on this process if it's helpful for anyone out there. And Alita, I'll throw it back over to you to talk about our Cooking Matters program.
Great. So another opportunity for reimbursement is our Cooking Matters program. It is a 6-week evidence-based program where we're teaching individuals how to prepare healthy foods, how to read food labels, and to live healthy on a restricted budget. This program is funded under the state's SNAP Ed program. So SNAP Ed, each state has their own SNAP program, and we applied for the education component of SNAP. So with this, we're able to provide education. The person does not have to receive SNAP benefits, but they just have to be eligible or live in an eligible area to participate in the program. But some of the items that are covered under our Cooking Matters grant are the education component. So we're able to cover all of our staff time and our instructors to provide the service. It does not cover food to take home, but it does cover any of the materials that we utilize in the class. So the class is usually about 2 hours. The first hour is instructional, where our instructors are teaching a lesson from the evidence-based program. And then the second half is hands-on learning. So they're learning the tools that they are practicing the tools that they were learning during the education component. So it's very hands-on, it's very interactive, and the individuals love it because they get to build a bond with their peers and talk to the registered dietitians or instructors about different meal components. It's an opportunity to teach them new things to eat and new ways to prepare food so that they can eat healthy. So in addition to staff time, it covers all the materials for the class, the books, and small graduation incentives, such as maybe cutting boards or measuring cups that we can give participants as a graduation gift. And it covers mileage to the class. There are a lot of, there's monthly reporting and annual audits, like with any other federal program. But the big thing is they like to focus on policy systems and environmental changes. You get actually a chance to be innovative with the program. So it will pay for some marketing if it's in new areas that you have not participated in, or if you need to contract with other agencies. Some of the exciting things that we've done is we've partnered with our public transportation system. So MARTA here in the Metro Atlanta area, where they were doing they were doing produce distribution at some of the MARTA stations, and we were able to provide some of the education and do pop-up demos at the transportation site to help individuals, to help the company increase their fruit and vegetable sales by showing individuals what they can do with the produce if they purchase it from the market. So that was some of the innovation things that we've done. We've done produce prescription programs. We've partnered with early child care centers also to be able to provide education to the children so that they can start at a younger age and eating the healthy foods and produce. Next slide.
I think we're here just to provide you some encouragement along the way to try and reimburse for meals and nutrition education. But thank you, everyone. Here's our contact information. I can't get it good to go. There we go. It just keeps going to the other one. There we go. So here's our contact information, my contact information if you need anything, but we're definitely around if you have any questions. Thank you for the opportunity, Ashley.
Thanks, Laura and Alita, for giving us more information on this today, as of course, we're always looking for additional resources throughout our work. Thanks so much again.
Thank you.